Hello guys, this is Dr. Deependra Pandey. As we know that today is World Heart Day. It is celebrated every year on 29th of September. In May 2012, world leaders committed to reducing global mortality from non-communicable disease by 25% by 2025. Cardiovascular disease is accountable for nearly half of all non-communicable disease death, making it world number one killer. World Heart Day is therefore perfect platform for the cardiovascular community to unite in the fight against cardiovascular death and reduce the global disease burden. Heart disease and stroke is the world leading cause of death, claiming 18.6 million lives every year. And the highlight the action that individuals can take to prevent and control cardiovascular disease death. It aims to drive action to educate people that by controlling risk factors such as tobacco use, unhealthy diet, and physical inactivity, at least 80% of premature death from heart disease and stroke could be avoided. World Heart Day is a global campaign during which individual, families, community, and government around the world participate in the activities to take charge of their heart health and that of others. Through this campaign, we try to fight against the cardiovascular disease burden and inspire and drive international action to encourage heart healthy living across the world. We believe that healthy heart is a fundamental human right and a crucial element for global health justice. Cardiovascular disease is a class of disease that affect heart or blood vessels, of course, veins and arteries. More people die from cardiovascular disease worldwide than from any other causes. Over 18.6 million every year. Of these deaths, 85% are due to coronary heart disease, we can say. Example, heart attack, and cerebrovascular disease, example, strokes, and mostly affect low and middle income countries. Did you know that your heart is the size of your first and the strongest muscle in your body? It started beating from the 3 weeks after you were conceived. And if you live to be 70, it will have beaten 2.5 billion times. However, although impressive and strong, your heart can also become vulnerable from habitual risk factors like smoking, diabetes, cholesterol, eating, and unhealthy diet, or living with a high blood pressure. The system can also be weakened from pre-existing heart condition and other physiological factors, including hypertension or high blood cholesterol. When your heart's function become compromised, this is known as cardiovascular disease. In a broad term, that covers any disorder to the system that has heart at its center. As we all know that after COVID-19, the patient who is suffering from cardiovascular disease, such kind of patient are more susceptible to the severe COVID-19 disease affecting some form of heart condition or heart function, include hypertension and diabetes, acute coronary syndrome, injury to the muscle tissue of the heart, we say myocardial injury, heart failure, and less heart but prevent disease such as rheumatic heart disease and Chagas disease. COVID-19 patients need to be designated for care based or disease severity so that patients with moderate and severe disease are admitted in the separate ward or hospital depending on the available infrastructure. Further, patients also need to be triage based or underlying health risks such as hypertension, diabetes, prior cardiovascular or respiratory disease, kidney failure, and cancer as a part of the process to identify patients with a higher likelihood of developing a severe form of COVID-19 and implement targeted care. Special attention must be given to ensuring that there are separate facilities in the place of dealing with COVID-19 cardiac patient and non-COVID-19 cardiac patient, including catheterization for performing invasive heart examination. So this year theme is use heart for every heart, and I wish you everyone have very healthy heart. So I want to appeal who had suffered severe form of COVID-19 and they develop multiple comorbidities related to cardiac health. They should check their blood pressure regularly, maintain it in a normal range. Lipid profile, they have to maintain it in a normal range and maintain a diet, better diet and better lifestyle. So thank you so much. If you think that my effort adding some value to live a healthy lifestyle, don't forget to subscribe my YouTube channel. Thank you. Have a great day.